It's just the two of us. It's just me and you.
Hello.
Hello.
Back in Rochester?
I'm back in Rochester.
How's it going?
So far, so good. Like Luke duking it into the parking lot.
We talked, after you left, we talked to clinical grand rounds for a little while. And we've got it on the leadership agenda to talk about, but the group thought maybe a morning meeting might be a good idea this time around. Try like a 7 a.m.
Okay. That sounds good to me. Are we going to shoot
There's
for
no
like
social element to be had, right?
right?
Why keep people away from their families for a Zoom call if we can avoid it? Most of the docs seem to be willing and able to do an early morning, so we'll talk about it
Yeah,
more.
that sounds great.
That's all you
We can
missed.
at least give it a shot.
Yeah.
Yeah. Okay. Well, that was good. I like it. Gonna give everybody a couple of minutes because everybody's kind of getting on now. Guessing it's going to be a thinner crowd because people are away for spring break and other things.
Yeah, give another minute or two. There always seems to be a flood like at 12:17.
Yes, 12:17 does seem to be the magic time. I will definitely take it as a personal offense if people didn't schedule their spring break plans around our 12:15 call.
Agreed.
Who needs to get COVID at Disney World when you can come and listen to us?
Well, now that Diego's here, I think we're free to get started.
All right, once Diego shows up, you know it's a good day.
That's right.
Thank you very much. I appreciate that. Just finished my COVID vaccine clinic of the morning.
Woohoo! How many did you guys administer today?
We did about 30 this morning.
Nice. Very nice.
Yeah.
Very good.
And we've been giving some throughout the day because with J&J, it's easier to do it. We have the ability to give the vaccine, watch them while they have their visit. So it worked out.
That's good. Yeah, that's great. That's a win. All right, it's 12:17. We have a quorum at the moment, so we'll get rolling, knowing that some folks are off, hopefully doing vacation-y kind of things, because certainly the weather here is not great. And I will go ahead and profess at the beginning of this that I did not have time to update the graphs today because I'm slacker. That's all I can tell you. That's the way it is sometimes. But the numbers are correct. That's the good news. So in short, we are seeing at best a flattening, at worst a slight increase in cases. Now, interestingly, and perhaps for the first time since the beginning, the group that has seen the sharpest rise in cases is teens to early 20s. So is that because it's spring break? Is that because, kids are finally just having withdrawal from their friends and it's nice outside and they're spending more time together? The answer is probably yes to a little bit of all that. There's even some concern that now as more and more parents are vaccinated, that parents are probably letting their guard down a little bit. Kids, even though they're not vaccinated, are kind of following suit, and therefore they're getting more exposed. So, I think that's the reality of the world at the moment. The question is this a blip, or is it truly a upswing of another small surge? Certainly, Dr. Walensky from the CDC and others, they're definitely chomping their nails a little bit because it has all the makings of a potential surge. Certainly, if we look to Florida, where they have seen a resurgence of variant cases. In fact, the variants are now if I'm not mistaken, I think now the most common etiology of new cases in Florida. So, there are some warning signs from different places in the country, but we're certainly not seeing the rate of rise that we have, especially in the last surge. And, especially if we look to some of the southern states where they have relaxed measures faster than we have. And, some of those states, if you look at Georgia, even kind of southern Alabama, where spring break was impetus, we have not seen the same surge in cases in those areas that we saw even after the holidays. So reason to hope for sure. Locally, we are now above 30% of all qualified individuals who are vaccinated. So in the 10-county Finger Lakes region, we have now surpassed 1 in 3 that qualify who are vaccinated, which is great. That does mean it's getting more and more difficult to find those who are willing to get vaccinated. And we are starting to not only run up against the hesitancy factor even more, but we're also getting into the group that is being very finicky about wanting one vaccine versus another. And surprisingly, whereas I think all of us were a bit afraid early on that people were going to shun the J&J vaccine in favor of Moderna and Pfizer because of efficacy, it's exactly the opposite that we're seeing come true. People are wanting the J&J because it's one shot. And even in more minority populations, they seem to be more in favor of the J&J vaccine because of the one-shot benefits. So that's been an interesting development that some patients are now saying they'll get the vaccine, but only when and if they can get the J&J, which was not necessarily what was expected. So, I think this is something we're going to have to keep an eye on and kind of follow. We're certainly, I know for the regional affiliate hospitals, we reached a point, I think it was last week, where none of the affiliates had any COVID cases inside the 4 walls. But, I think now we're, on any given day, there's one here, one there. Even Strong is down to, I think it's maybe 10 or something like that, total COVID cases, which is certainly far below where they were before. And some of those are, kind of on the amend and waiting discharge. So we're definitely not seeing the hospital occupancy in our local region, which is good. But we are starting to see a little bit of resurgence of cases. If there is a silver lining to it, it does seem to be in a younger population who were always the group that manifested less severe symptoms to begin with. So if the gods are with us, that won't transfer into hospitalizations, mortalities, and the like. So that's about where we stand. If we flip over to Nick Apostolaris's graphs for the region, you'll see kind of the same story being told kind of across every county. Again, we're still seeing those upticks. Erie County is interesting in that they've seen a fairly significant surge in cases amongst teenagers, even more so than what we've seen for sure. But the rest of the counties are all seeing kind of a flattening or slight uptick in their case rate from where we were even a couple of weeks ago. Hard to say, is this the post wave that we got from spring break? If so, it's probably not as bad as what we thought it could be. Certainly in our region, spring break is right now, so we may not see the full effect of that even for a couple of weeks. But for those who have been, college kids who are traveling and coming back, some of their spring breaks started a little bit earlier, so theoretically we would have seen some of the effects of that already by this week, which may be factoring into this discussion, but certainly not as severe as what we saw even just a couple of months ago. So that's about where we stand in the world. Testing is still very plentiful. As far as we talked last time about testing platforms, no one has reached out to me either by lack of interest or just forgetting about wanting to pursue testing in their office right now. I think the testing availability just continues to be supra what is being ordered at the moment. So it should not be a problem to get testing fairly easily. So I don't think should be a concern for the time being. From the vaccine standpoint, lots of developments. So this week should be, probably from now until summer, if everything goes the way we're expecting, the last week where we see a slight thin dissemination of vaccine. We're still doing better this week than we were a couple weeks ago. But next week is where we really start to expect to see the glut of vaccine starting to hit the region, the state, the nation, as some of these contracts start delivering. So the hope is that by next week, whereas, I can say for Strong and Highland, they've been getting anywhere from 2 to maybe 4,000 doses. I've heard that they could get as much as 6,000 to 8,000 doses starting next week. The affiliate hospitals that have gotten 0 to maybe 100, 200, they were told initially they were each going to get 1,000 doses. It sounds like it's probably going to be more close to maybe 500, 600 doses apiece. So clearly everybody is seeing an increase in volume of vaccine. I expect that for all of you who are vaccinating already, that will mean more vaccine that's floating to you. And for those who are interested, there will likely be greater availability, as already there's been some discussion at the hub about redistributing doses. We know, I think it was as of end of the week last week, there was some discussion that there's going to be an incremental 800 doses of J&J that are going to come to the hub for kind of redistribution. So, there's already thoughts about how they're going to use those incremental doses that weren't even factored into the larger incremental increase that we expect. So that's going to be good. So hopefully the vaccine will be keeping pace with the interest. And more good news, as of yesterday, the criteria dropped to age 30 to qualify to get the vaccine. That's without any requirements of predisposing conditions. And as of April 6th, it will be anybody over the age of 16 can get the dose. So starting next week, it's basically come one, come all. So anybody over the age of 16 will qualify. Just this morning, for anyone who hasn't been tied to their cell phone or CNN, Pfizer announced that in their study of 2,260 adolescents from age 12 to 15, they had 100% efficacy at preventing COVID. So several interesting things came out of that trial. Number one, the vaccine was effective in 12 to 15-year-olds. Number two, we did not see any increase in side effects from what we saw in the 16 and over population that has been studied. Number three, and maybe the least talked about piece, is in the placebo group, there were only 18 cases of COVID. So the incidence in that group, even though we're talking about, that group has had a burgeoning level of incidence since the beginning of the year, the incidence is still pretty low. Only 18 cases out of 2,260 total kids in that study, which only began enrolling maybe a couple months ago. So 100% efficacy at preventing contraction of COVID. Obviously, if nobody gets COVID, nobody manifests moderate or severe symptoms. So 101% efficacy at preventing severe symptoms, which is great. So all good news. They plan to get that to the FDA possible. So it's still, the anticipation is it still could be a couple of months before that's readily out for administration. But the hope is that that'll get sped up pretty quickly, at least for the Pfizer vaccine. Already there's discussion about what does that mean for utilization of for administration to the 12 to 18 crowd, and use Moderna and J&J for the 18 and up. It probably makes a lot of sense to do that. But obviously there'll be people who are much smarter and better elected than I am that get to make those decisions. So we'll see where that goes. First we had to get past the FDA approval for that expanded age range for Pfizer. Pfizer also announced that last week they started enrolling in a trial for ages 6 months to 12 years old. And they anticipate being able to fully enroll that trial within about 3 months, I think they're anticipating. Moderna actually launched the same age range about 3.5 weeks ago now. So that trial should be forthcoming very quickly. And J&J is planning to launch a trial in, I think, at least 12 and up, but I do not think that their adolescent trial has launched yet. So lots of good news there. The big moral of that story is hopefully Pfizer will be available to administer to teens, all teens, by early midsummer. But all vaccines may be able to be administered to kids before school starts again in the fall. And that would obviously help tremendously in getting everybody more comfortable, getting kids back to school full days across the country, and potentially even able to decrease some of the distancing parameters that are in place. Already, you probably heard that there's recommendation and slow filter of decreasing the social distancing in schools from 6 feet to 3 feet. That should help with classroom spaces, especially in smaller urban and rural schools that don't have some of the space that some of our suburban schools have had. So hopefully all of that's going to manifest into good outcomes. I just saw in the chat from Sandy Bullard, the quarantine for people with vaccines. So that is true, except for healthcare workers. And truthfully, I got to figure out where this landed. They've been going back and forth. There's been some conflicting guidance from the state about whether healthcare workers who have been exposed have to have any quarantine, or can they return to work? Do they have to do the 10 days quarantine? So I've got to figure that part out. I don't know where they landed. Renee may know that. She, I think, was able to attend. You don't know. Okay, so we'll figure that out. I know it's been in discussion because there was a release of information on the 10th that somewhat conflicted with the release of information on the 26th, I believe it was. And so we're trying to validate which one is correct. Yes, that's true. College students quarantine because roommate is positive. Yes, that is happening more and more. So from a vaccine standpoint, more vaccine flooding the zone next week. We're going to see return to vaccination of inpatients even this week. We will see greater vaccination of all ages 16 and over starting April 6th. Already there's been a slow uptake of getting it to 30 to 50 because it was only last week that we dropped the age from 60 to 50. And now, we dropped the age down to 30. And now 6 days later, we're going to drop it to 16 and over. So there's the ripple effects probably won't come as fast as that day. But hopefully this will allow for come one, come all kind of approach to administration of the vaccine at all sites. So I think that's all I have to say about the vaccine. I think that's really all I have in general for right now. Renee, anything else that you had or anything else I missed?
No, I can't think of anything.
Okay, that was easy. So now we can just open it up to play Stump the Audience for questions, or 28 minutes of your life back potentially. That would be the greatest gift ever in the history of COVID calls. All right, not hearing anything yet. So as far as going forward, so the next couple of weeks, I think, are going to have quite a bit of development as far as the vaccine, the ages, how we're going to administer. So I think there's probably still value in continuing this for the foreseeable future. I do think at some point, this has been such an effective avenue to disseminate information quickly that how we can use this even for kind of our normal course of healthcare delivery probably has benefits. So we're going to be talking more about that in the coming weeks, keeping our fingers crossed that COVID's going to continue to fall off and there will be nothing else to talk about in the world of COVID, and everybody's going to be vaccinated and it's just going to be happy hunky dory. Just know there was a discussion, I believe it was Monday, that the current data is starting to point to about a year of efficacy of the vaccine. So hopefully by summer, every American is going to be getting vaccine into arms. We'll get to that magical 70 to 80% herd immunity statistic. And then it will be a very short time seeing the beginnings of vaccination. So we'll only have a few months before we'll have to gear up again and start the process of potentially doing booster doses for everybody come into the year. So this is going to become a rolling part of our life, probably for the foreseeable future. But it seems at least that we've got more and more vaccine that's coming online, that's getting approved. Even some of the Russian, Chinese, other international vaccines seem to have pretty good efficacy and safety parameters as best that we can tell. So whether some of those vaccines may actually come into the marketplace as well in the months ahead, kind of remains to be seen. But I have not heard any concern. Even AstraZeneca, after all it was good, it was bad, it's probably good. Their re-up of the data actually looked quite good. And so unfortunately, it probably was a bit of a PR disaster for them, the way they did the release, whether it was intentional or not. But ultimately, the data suggests that the AstraZeneca vaccine is quite good. So we likely will see that coming to FDA review in the not so distant future either, which could be good as well. So nothing else in the chat room. So with that, if nobody comes off mute, we will call it a day. All right, guys, 25 minutes of your lunchtime back. Enjoy. We'll see you next week.